Hi everyone, I'm Lydia and I work in the communications team at the MS Trust. Today I'm joined by Lucy Harmer, who's Director of Information and Engagement at the MS Trust, and she is going to answer some of your questions relating to COVID-19 and work, which we know is a topic that many of you are feeling really worried about. So thank you so much to everyone who sent in questions. We will do our best to answer them, to ease some of those worries and hopefully clear up some of the confusion which is out there. And if anything we say you want to know more about or you're not quite sure of, please don't hesitate to get in touch with our Enquiry Service. You can call the team on 0800 032 3839 or email ask@mstrust.org.uk. We'll repeat those details at the end as well if you don't have a chance to write them down. So let's crack on. So welcome, Lucy. Thank you for joining us and answering some of these questions. So I mentioned there that there's so much confusion at the moment around issues relating to work. So perhaps if we could start with a question around, clearing up some of that confusion, I guess. So all the rules and support around employment and COVID-19 are changing. It's kind of hard to stay on top of what this all means. Can you maybe just run through what COVID-19 means for MS and what's changing and when it's changing?
Yeah, thank you, Lydia. And you're right, it is really confusing. The situation seems to be changing, daily or at least weekly at the moment, doesn't it? And at the MS Trust, that means in the Enquiry Service, we're getting a lot of calls in from people just asking, what's changed this week. So I'm happy to run through it. Firstly, I think it's really important to remember, if you are a person who's living with MS, you're not necessarily at any more risk than the general population of catching MS. There are some exceptions to that. So it may be if you're taking certain disease modifying drugs, that may increase your risk. That has an issue to do with your immune system, that can increase your risk. But in general, most people with MS are at the same risk level as the general population. One of the things that can be an issue, though, is if you're more severely affected by MS, or if you have other underlying health conditions as well as MS, so maybe something like asthma or things to do with your respiratory system, that can increase the risk of severe complications if you do get COVID-19. So that is one of the reasons why many people with MS are either taking quite severe social distancing measures and they're being very careful to reduce their risk of infection, or they've been classified as some of the most vulnerable people and they've actually been formally asked to shield. So shielding as a measure is where people have been asked to pretty much stay in their own homes for 12 weeks. And that's been something that quite a lot of people with MS, as I've said, are actually having to do. So shielding clearly can have an impact on your ability to work. If your work can't be done from home, that can be a real problem. So many people who are shielding have opted to go onto the furlough scheme, or are using statutory sick pay as a means of actually getting some money in, some income in during those 12 weeks. So shielding as a scheme is due to end at the end of July. And what that means is if you're receiving statutory sick pay because you're shielding, that will also finish at the same time. Furlough, however, is due to go on until the end of October. And we've been told that the government intends for it to end at the end of October, and they're currently starting to wind it down. So from July onwards, the way that furlough works and the amount of money that your employer pays as part of that scheme is going to change. And there are options for you to be able to work part-time if your employer needs you to as well. The other thing that's changing at the moment quite rapidly is we've been having a lot of information coming through from the government about what type of businesses are reopening when. So we're already seeing, so just in case, I'm not sure when you're going to be watching this video, but we're recording this at the end of June. So we know that next week, in the first week of July, a lot more non-essential businesses are going to start reopening. And we know that following that, there's going to be a lot more other businesses reopening as well. Some of the leisure and tourism, for example. So what that means is we're starting now to get inquiries from people who live with MS about whether they're going to have to return to work, what's their level of risk, what does this all mean for me, how do I navigate this as we move out of lockdown?
And you mentioned it there, Lucy, the F word, furlough, a word that probably many of us would not have heard of before this pandemic. And the next question relates to that, actually. This person wants to know if being furloughed because they have MS is discrimination.
One of the important things to remember with furlough is it doesn't affect your statutory employment rights. So it isn't a break in your contract. You remain fully employed by your employer. Your contractual rights remain the same. So when you're looking at furlough and discrimination, although it sounds like an easy question, it's actually quite complicated, and it will depend on your individual situation. So if you are unable to go into your work, you're unable to work. So for example, because you work in a retail environment and you're shielding, or you live with somebody who is shielding, so you're unable to actually perform your duties, it's reasonable to be asked to be on the furlough scheme in that situation. However, if your work can be done from home, so if say you work in an office and it's absolutely fine for you to be able to work from home, then it may feel odder or less obvious about why you've been asked to be on the furlough scheme. Now, there are lots of reasons why that may happen. It may simply be that your employer actually has less work for you to be able to do. It may be that their income is severely reduced, so they have less money and they're unable to pay all of their teams. They may have a pool of people that they were looking at to see, we need to reduce the number of people we have working. We're going to have to do a selection process to make sure that, which of the 5 out of 10 people are we actually going to furlough? Now, in those situations, what your employer has to be able to demonstrate is that they followed a fair process and that they haven't discriminated against any of the protected characteristics that are written into our employment laws. So that's things like age or sex and disability as well. So whether or not it's discrimination to be asked to be furloughed is going to depend on both your individual circumstances and also the process that your employer has followed. However, when I was thinking about this question, one of the things that struck me is whether they're actually worried about something slightly different. I think we're coming towards the end of the furlough scheme now. And I think a lot of people at the moment are wondering what's coming next. And a lot of people are looking at their work and thinking, actually, is this still viable? Is my employer struggling at the moment? And people are worried about redundancy. We've certainly been having some questions at the MS Trust about whether I'm more at risk of redundancy if I've been placed on the furlough scheme. And it may be that that's what this questioner is actually worried about. If you're worried about redundancy and furlough, I think a really good thing to remember is the redundancy process is very well defined. We have very clear legislation in this country about the kind of process that you have to go through and what is fair or not when you're making redundancies. If you are worried about this and you're in this situation, go and look at the Citizens Advice website. Citizens Advice has got some great resources online. And it's really clear there. They've got some fact sheets which will explain what your rights are through a redundancy process and what a fair process should look like and what process your employer should actually be following in this situation.
Thank you, Lucy. And our next question comes from a barber, and they ask this. I'm wondering if furlough means that those who are at risk can stay off work until a vaccine is found.
And again, I think all of us are looking forward to the hairdressers reopening, aren't they? It's one of the things that I think we've all struggled with in lockdown. I certainly have. As we said earlier, the furlough scheme is due to close at the end of October and it's slowly being phased down. But you can be recalled. Even if you are on furlough, you can be recalled back into work if the work situation changes before the end of October. Now, we know that hairdressers are one of the types of business that is due to open up at the start of July, which I think from a customer point of view is great, but you can understand from a barber's point of view, there are risks involved in that and that they may well have concerns about how that's safe. it's important to remember that your business can only reopen as long as it's what the government is calling COVID safe. So we have quite clear health and safety legislation in the UK, which outlines the duty that employers have to make sure that they provide a safe workplace. And on top of that, the government's been issuing a lot of detailed industry-specific guidance at the moment to help employers understand, what do I need to do to make sure that my workplace is safe? And I know that there's quite a lot of guidance out there for hairdressers. Most of it you can see if you're interested as a member of the public. You can go onto the gov.uk website, and it's fairly easy to find the sheets of guidance they've issued for hairdressers, for schools, for all sorts of other types of business on how to run them safely. So if I was given advice, what I would say is, have a look at what your employer is suggesting they're going to do. Talk to them about what risk assessment have they done, what risks have they identified, and what mitigation are they putting in place. And that will give you the confidence to know, do I feel safe? Does this sound as if they're meeting what the government guidance is in terms of what my workplace needs to look like? The other thing that somebody should do is go and talk to their MS team. As we said earlier, the risks around COVID-19 for people living with MS are very individual. It's going to depend on a lot of factors, what your MS experience is, what other underlying health conditions you have, what kind of treatment options you're following as well. So talk to your MS team, and they'll be able to help you understand the level of risk that you have yourself.
And you mentioned there about what workplaces, a hairdresser or barbers particularly, could do to make a salon COVID secure. What kind of measures could they put in place?
I think some of the things that I've seen mentioned in the media are things like there may be fewer appointments available, and that could be because of the distance that is going to have to be between the individual chairs that you have in a hairdresser's. Other things that I've seen people talking about, I think one of the things that sounds quite sad actually is maybe no more free magazines. And they might not be giving you those teas and coffees that you get when you're at the hairdressers as well. And that's because of the risk of transmission, because there are fears that the virus can live on surfaces. So you want to be careful about touching objects that somebody else has touched as well. And of course, I think there's going to be recommendations about the kind of PPE that hairdressers have to wear. I don't know whether clients themselves will have to wear masks, or whether it will be the hairdresser that wears masks. I don't know, what have you seen, Lydia? There's been a lot of it in the newspaper this week with speculation on what's going to change.
I've seen headlines around no more small talk, which will make going to the hairdresser quite a different experience if there's not the same chat about your holidays and what you're having for tea and all those other things that you like to talk about.
It'll make all those introverts happy though, won't it?
Yeah, it will, exactly. I know my hairdressers actually sent around an email only this week listing all the measures that they've put in place, a lot of which you've already mentioned. And I think it seems that salons are being really vigilant about how they are making their workplace COVID secure and really kind of taking this advice seriously. So that was good to know, and definitely kind of eased some of my worries about going back to the hairdresser, because I know I definitely need my roots done.
Exactly. And I think the key to it for us all to remember is it's about being safe for the people that work there, and it's about being safe for the people who go there. So it's from both sides, and everybody has to be safe.
Absolutely. So the next question is from an NHS community worker. He says they are desperate to go back to seeing patients, but I take tecfidera and my latest bloods were all fine. What should I do?
So I think the important thing to remember with this one is that most disease modifying drugs do not significantly increase your risk of COVID-19 or its complications. And the ABN has actually got some really useful guidance out on which drugs are safe and which drugs have different risks attached to them. And when they look at the risk profile, they've been looking at this at a community level. So they're thinking about what's the risk in your area as well. So the risk of becoming infected with COVID-19 is going to vary over time, and it's going to go up and down, and it's going to be different in different areas. And neurologists are going to have to think about all of that when they're making recommendations about what kind of treatment you should start, or whether you should continue with treatments, and what your risk is as well. And in the case of tecfidera, the ABN is saying that it doesn't increase the risk of coronavirus infection unless your white blood count has been low for quite some time. So in this instance, again, the advice would be go and talk to your MS team and have a detailed conversation with them about the risks in your area, the risks attached to the type of work that you do, and remembering if this person is an NHS community worker, they're likely to be doing frontline work. So in order to be able to keep that safe, there's particular measures that they're going to have to take into account, and particular ways of working and changes that will have to be introduced. And that means that, being really sure about what this means, even though it sounds like it's relatively low risk in this instance.
Thank you, Lucy. And the next question also comes from someone who works in the NHS at a GP surgery, and they say the following. Work sent me home mid-March prior to being shielded to work from home. I'm feeling really fed up, and there is only so much work I can do from home. So I'm keen to be back at work and hope I can. But I'm nervous about what work will say about coming back.
So I think there's a few things in this one, actually. So firstly, shielding is due to finish at the end of July. So it's reasonable, I think, to assume that you're going to go back into work. And it sounds like this inquirer is ready and is looking forward to going back to work. A good starting point is going to be talking to your MS team, making sure you understand the risks, making sure that there's nothing else that you should be worried about, or what it means for you, but then also talking to their work. Now, a GP surgery is interesting because we don't know what role they do there, and we don't know what type of work, and clearly there is some work that they have been able to do from home. So depending on the role they're in, it's important to remember that the government guidance is still saying very clearly, if your work can be done from home, it should be done from home. So it may well be that their employer actually wants this person to continue working from home, and that's a reasonable thing for the employer to want to do, because they have a duty to make sure that they're keeping people safe. However, what I would say is, in any situation where you're going in to have a conversation with your employer, and you know what outcome you want to achieve through that, and you're kind of concerned about change and how you can make sure that the conversation goes in the way that you want it to do some planning ahead. Think about what it is that you would see as a good outcome. Think about what your employer may see as a good outcome, and be quite proactive about having identified what you think potential solutions could be. I think if you can take that approach when you talk to your employer, you're more likely to end up with a good result from it. And think as well, though, if the employer is likely to say, actually, we think you should continue at work because you continue working from home because the work can be done safely from home, it's okay to ask to do more work. It's okay to ask if there are other duties that you can do if you're finding that you're getting fed up, you're struggling with not having enough to do, because that can also be really difficult. I don't know, Lydia, one of the things that struck me with this question in particular was, I think lots of people at the moment are struggling with some of the issues of feeling really fed up with all of this, or feeling nervous and anxious about what's going on at the moment and the impact that that's having on people. I don't know, I know that you've been leading on wellbeing at the MS Trust and trying to keep us all fit and healthy and feeling positive about the situation. What kind of resources have you been recommending for people who are feeling sort of overwhelmed with the situation at the moment?
Yeah, absolutely. I think we're hearing from lots of people who are feeling, with MS, who are feeling quite isolated from being on their own for such a long period of time, not being able to see loved ones as they usually would, and also people who are feeling anxious about what's ahead and actually going out into this new normal as lockdown measures start to ease. Some resources that I found really useful and I often recommend to my friends and colleagues at the MS Trust So Mind, the charity Mind, their website has some really great resources and tips, practical and simple steps that you can take to look after your own mental well-being. And also a website called Every Mind Matters, which is an NHS initiative, which also has exercises to kind of look at your own well-being and if there are things you can do to help, and also some tips on working from home, which many of us will be doing at the moment, and perhaps is something that can be quite detrimental to your mental health sometimes if it's not necessarily used to. So I would definitely say Mind and Every Mind Matters are two resources that are definitely good to look up if you're struggling at the moment. But there's loads of other stuff out there as well. So for the next question, so this is an interesting one, and also quite a complicated question, I think. This person asks, I know some people on Ocrevus who have been told by their neurologist that if they have the infusion, they should shield for a further 12 weeks after the infusion. Legally, if this was advised by a health professional, and you are not able to fully fulfill the role you are employed to do from home, where do you or your employer stand as the furlough scheme starts to be faded out? Can you be made redundant due to this, or does the Disability Act offer cover to the employee?
Yes, you're right. That's quite a complicated one. I think that question actually falls into two parts. So firstly, if you're thinking about the advice that you're going to get from your neurologist about treatment, the really important thing here is that any advice is going to be very tailored. It's going to be tailored to the individual, and it's going to be tailored to the circumstances of what's going on and what the level of risk is at the time that the treatment is starting and the decisions are being made. So if the person that this inquirer knows started their treatment in, say, March or April of this year, the guidance then was very much that with that particular treatment to shield for 12 weeks. And that will have been relevant to that individual's health, their particular MS and their other conditions that affect them, and also the level of risk that there was in the country at that time. And that's when shielding was introduced. If you're going on to treatment now, the advice that you get may well be different, and that's because the level of risk in this country at the moment is much lower and the shielding programme is due to end. And it also means that the advice would have to be tailored to you as a different person with MS that's looking at taking that treatment. So it isn't as simple as saying that what happened once is going to happen again. It may well be at the moment that if you were looking at disease modifying drugs at the moment, your shielding time recommended might be, say, 4 to 6 weeks. And it may also be that rather than being asked to shield, that you're actually signed on onto sick. So you have to think about it and in terms of what's the issue for you now, rather than worrying about what happened in the past. The second issue on this one is about redundancy. And again, I think this is coming down to the worry that a lot of people are having at the moment about what's the impact of all of this time off going to be? What's the impact going to be for me if my employer is having to make some difficult decisions and if there isn't enough work in my work? The thing to remember is, in terms of redundancy, that applies because the post that you fill is no longer available. So you're not made redundant because of you and what you're doing. You're made redundant because the post is not needed anymore. However, if you spent a lot of time off work because of sickness, or if you're unable to fulfill the majority of the duties in your role and there aren't suitable other forms of employment or reasonable adjustments that your employer can make, then there are instances when it's reasonable for your employer to dismiss you because of capability. So it's saying you're no longer capable of doing your job. Now, again, in this country, there's very clear employment law on this, and there is a very careful process that your employer is going to have to follow, and they're going to have to be very clear that they're not being discriminatory and that it's a valid capability dismissal in order to be able to do that. And as I said before, if you're worried about this as an issue, go and have a look at the Citizens Advice website. They've got some fantastic resources there around sickness dismissal, and they will talk you through what a fair process looks like and what your employment rights are in this circumstances as well.
Thank you, Lucy. Our next question comes from a primary school teacher. So they say this: I'm working from home at the moment, but thinking of returning to my socially distanced pod of 15 children in a few weeks' time. Should I return, and what are the risks if I do return?
So again, I think schools has been a really interesting one, hasn't it? The starting point again would be, if you have specific concerns about risk, you should be talking to your MS team, because they're best placed to discuss with you what your individual health risks are. In terms of schools, it's really interesting. There seems to be evidence coming through that children are at low risk of catching COVID-19, and they're at low risk of spreading COVID-19. In fact, I think someone I was talking to recently said that the most dangerous part of a school might well be the staff room, where all of your colleagues are, and it's how you're going to be interacting with some of the other adults that might be a higher risk. So I think a good starting point again is going to be talking to the school, really understanding what risk assessment have they done, what measures have they put in place, and what does this mean for you as an individual.
And again, talking about measures and making a school environment COVID secure, but still an environment where children can learn and grow, what would be some of the measures that you think schools would be considering making in the coming months?
So some of the things I've seen mentioned are arrivals and collections in the playground, and whether parents should go into the playgrounds or not. I think that can be, that's an interesting area. How people move around the school. Are they going to have one-way flows? How are they going to stop different bubbles mixing with each other? Some of the kind of hygiene practices that people have to follow. I think one of the great things with children actually is you can often get them doing different behaviours quite quickly, and certainly helping people understand, if you're going to cough and sneeze, coughing into your elbow and things like that, I think are going to be really important, because we do know that good hygiene, hand washing, hand sanitisers, being very careful not to touch your face during the school day, all of those measures are going to be the simple things that probably make a big difference. One other thing I'd say to think about, though, if you are returning to work, is think about how you're going to get to work. So I live down in London. For me, getting into work is going to mean having to get onto the tube and buses and London transport and all of the different risks that are associated with public transport. Other people I know in Letchworth, where the MS Trust office is based, people are lucky enough to be able to walk around the corner and actually just walk straight to work, or you may have a car so you can actually just drive and know that you're not going to be interacting with anybody else or touching any other surfaces. So I think the level of risk around actually your journey to work is something that people should be bearing in mind.
And the next question is from a librarian who works for the county council. My colleagues are shortly returning to work, as libraries will be opening at the beginning of July. I have been told I am not expected to go back yet, but I would really like to, and I wondered what the risks would be. There will be minimal contact with the public to start with, as it will be click and collect book service, but obviously we will be handling returned books.
And again, I think it's a difficult one, isn't it? Because if you've been told you don't have to return to work yet, that may be because some of your role can be done from home and because your employer is worried about risk. So have an honest conversation with them and have a conversation about your risk levels and what measures they've got in place for the whole of the workplace in order to be able to feel safe with that. And again, I think a lot of the measures are very similar to ones that we've been discussing already. It's about taking care of good hygiene. It's not touching your face. It's being very careful. If you're working away from the front line, that's probably a good starting point, because there will be less risks if you're not working directly with the public.
And what about the evidence for the virus being spread through books? The person here mentions her worry about handling returned books. Is there much evidence that it can be spread in that way?
So I Googled this because I was interested in this one as well. And I went right down a rabbit hole here about the transmission of COVID-19 and how long it lasts on different types of surfaces, and there seems to be really mixed evidence. I think the honest truth is we probably haven't had the virus long enough yet to know the answer to some of these questions. So I would say I'd expect that the library is going to be doing things like potentially quarantining books when they come back. They may well be saying to people, don't pick up a book and have a flick through it. So you can take a book out, but actually pick it up when you know you want to keep it. A good, simple solution is probably going to be to wear gloves. If you know that you're going to be working in an environment where you're touching items a lot, if you wear gloves and if you wash your hands after you take your gloves off, you're already minimising the risk quite severely here. I think it's a bit like with shops. There seems to be a lot of changes coming through with guidance in shops at the moment about not just how many people can go into a shop, but whether you should pick things up or how much you touch things when you're in a shop.
Yeah, absolutely. And then the final question, an important one as well. How can the MS Trust help me?
I think it is. What we've seen at the moment at the MS Trust through the Enquiry Service is just how many people are getting very confused about the changes in the guidance and what it means for them. We've had record numbers of people contacting our Enquiry Service on all of these different issues. So if you are confused about any of this, great starting point, visit the MS Trust website. We've got some dedicated resources there about COVID-19, and we're updating those every time the guidance changes. So that's a really good starting point. If you want to talk to one of our expert advisors, somebody who can just talk through what this means for you, then contact us through the Enquiry Service. And you can do that by email at ask@mstrust.org.uk, or you can just simply call us on our helpline as well. And one other thing that we do at the MS Trust that we've seen being really useful at the moment is we have a great Facebook group, and that allows people with MS to link up with other people with MS and actually share their experiences and talk together. And we've had a lot of feedback over the last few months about how positive people with MS have found being able to share experiences with other people that are living with MS too.
Absolutely. We should also mention the other social media channels that the MS Trust have. So you can find us on Facebook, Instagram and Twitter, and we share all the latest information and guidance around the coronavirus and lots of other information about MS too, as well as personal stories.
Yeah.
And it's just a really great place to sort of stay up to date. So do give us a like or follow. And I think that's it from us now. So we really hope that that's been useful. And as I said, cleared up a little bit of that confusion. Thank you for watching, and thank you, Lucy, for answering those questions. Take care, everybody, and stay safe. Bye.
Stay safe.